Very much like putting a skewer through a hot dog. You want to have that same angle, that horizontal approach, and you want to get in the middle of it.
Does the bevel have to be up too?
It
here?
is.
Okay.
So you're not like this, you're not like that, you're not like this, you're not like that. You're completely horizontal. You go in half an inch away because the needle's half an inch away. Okay, and you count so they can prepare for the poke. 1, 2, 3. I'm using a 30 gauge needle now. See, look at my thumb. As it pushes, I pull back. And the reason why I'm injecting this side is because this side is smaller than that side, and this side is less round than the lower lip. You just got to get all 4 sections of, if you had 4 kids, would you love one less than the other? Everything in life is symmetrical. Everything in life is based on balance and equilibrium. Open. 1, 2, 3. You see how I'm in the middle of the lip? That way you don't get lumps. That way it looks natural. And it also elevates the vermilion border. Russian technique, Ukrainian technique, it doesn't matter. The brain wants to see symmetry and contrast. Okay? So this is the best way to do it because you're putting the product deep inside the lip. You're going very, parallel to the plane of the lip. It's elevating the vermilion border and it's creating symmetry. How did that feel?
Fine.
Yeah.
Great. Thank
Yeah.
you.
Okay. So you see how it's starting to match the rest of all the other sections of the lip. Okay. Let's turn. So you evaluate. Needs a little bit more. It's just going to be hard because that lip is shorter. It's like half an inch shorter. So you're just going to have to do the best you can. 1, 2, 3. Sorry. Open. Open. 1, 2, 3. Okay, good. So that took about 0.2 and a half milliliters. We don't look at our markings. We look at the lip. In your mind, you are just telling yourself, I have to get all 4 sections of the lip the same. And you're going in this way. Okay. See how natural, beautiful that looks? Okay. So now you see compared to this lip, especially this section here is a little small and flat. Like look at the protuberance here and look how flat it is here. So am I going to add more volume where it's already sticking out? No. I want to get it even and natural looking. So I'm going to add more volume here that's smaller and flatter compared to the rest of the lip. So we'll do that next. Are you ready?
Ready.
Okay. So I can go in like this, same approach in the middle. 1, 2, 3, you count, half an inch away. Push. Look at the plunger. As the plunger's moving, you're pulling back. 1, 2, 3. As the plunger's moving, you're pulling back. Good. So it'll start swelling. You can get lumps and stuff. That's all, that's okay. It's temporary. It's okay. The lip's going to swell. The lip is going to swell. You have to tell them the lip is going to swell. You're going to tell them that. Don't call 911. Don't call your mother. Don't call your therapist. Just expect your lips are going to look abnormal for 3 or 4 days. The lips are very vascular. You're going through tons of blood vessels with the needle, and it's going to bleed. It's going to swell. It's going to bruise. That's why we have people stay off of alcohol, aspirin, Advil, fish oil for 3-4 days before. But you just have to set the right expectation. Now you can see how that got corrected nicely. You see how that section is starting to match. It even matches that. Remember how flat it was. And now look how pretty this is. See how her whole lip is starting to become more symmetrical. She can probably use a little bit right here, right there. So I'm just going to go in like this. Add a little bit right there. Okay, good. So now you see how you're creating, symmetry and contrast. Now in her case, she has even though it lifts the vermilion border, her vermilion border is a little ill-defined. Do you want me to kind of define that a little bit?
Sure.
It'll look nice. It'll look nice.
I think it always
Yeah,
looks
yeah.
attractive.
Yeah, it does. And we're just gonna do, minimally. So we've used about half of it. It's time to change the needle. Have her put pressure here. Let me give it so that there's no blood. Okay. So go ahead and
With ice or not?
No, pressure.
Okay.
Okay. Go ahead and apply pressure. I'm gonna change the needle. I'll be right back.